Hi everyone, my name is Nicoletta. Today I'm going to be talking about sex therapy. I specialize in, like I said, sex therapy and then also trauma. So just a little bit about myself is I've come from more of a base of like trauma therapy and crisis, things like that. I've been in this field for 9 years. I've always really enjoyed intensive community mental health, things like that. And then I kind of started gravitating as I went through my master's program into people who have trauma. This also goes in part with my personal life and things like that. I've also always been interested in sex and sex therapy as I went through school. I always thought trauma was one of the most vulnerable spaces that you could ever be with a client because they're fully exposing themselves to you when they come to you. I feel the same way about sex therapy. So I'm very passionate about this. So why I'm here talking about sex is I believe that sex and intimacy is one of the most important parts of a relationship. So whether that's a relationship with yourself or with your partner or multiple partners, I want people to feel empowered and to know that our own desire and pleasure can make us feel more secure, connected, vulnerable, and I just want to share that with other people. Okay, so I always like to share this story. I have a friend. She loves to tell people that I do sex therapy. So we went out one night and she decided to tell this gentleman that this is, my friend and she's a sex therapist and all this stuff. I commonly get asked, oh, so you teach people how to have sex, right? What kind of toys would you recommend? What lubrication would you use and all these different things? So this is a common misconception. These are not things that we're talking about. We're all different as sex therapists. Like Charmaine, she also specializes in sex therapy. We are very different. But the common things that we do as sex therapists is we talk about topics such as anxiety, erectile dysfunction, things like that. We talk about, what sociological factors, social factors, biological and physiological factors affect your sex life and why aren't you able to achieve desire or pleasure or things like that. There's just more to sex therapy than just the tools and the resources. There's also the communication part. So if you have all these tools such as toys and things like that, if I'm not able to communicate with my partner or feel secure with myself, how am I going to be able to use these tools? Right. So who goes to sex therapy? I think a lot of times we don't know whether we need sex therapy or not. Some of the couples or clients that I see, I'm not normally satisfied with my sex life. Sex causes tension, anxiety, or trouble in my relationship or relationships. I don't think my partner understands my sexual needs, wants, or desires. My sex life negatively impacts other aspects of my life, such as work, daily functioning, relationships, or mental health. My sex life causes unhappiness, anxiety, shame, or guilt. I experience erectile dysfunction, pain during sex, or libido issues. I have a past relationship of trauma that impacts my current sex life. Sex therapy isn't just for people that have sex addiction or sexual dysfunction. I've also noticed that people who have generalized anxiety disorder or depression or PTSD, a lot of those types of disorders can actually affect our sex life. So if we just address maybe the anxiety issue, then it actually can help alleviate that stress that I have for sex and things like that. I think the other thing is, why is sex so important? A lot of times I see couples and they haven't had sex for 10 years, 15 years, sometimes even 5. So why is this so important? So our brains are made up of chemicals, hormones, and neural pathways. All of these things in our brain are connected to our body. It's connected to our heart. It's connected to our lungs, our digestive system, and things like that. So when I feel good, my brain is going to send all of these signals and chemicals in my body that's going to make me feel good. So the best example of this is I could have the worst day ever. I could, come to work and be really stressed out and sit in traffic, and maybe I come home and the baby's crying and I can't calm her down, but I know as soon as my husband walks in the door and I give him a hug and we can hold each other for even if it's a minute, it's going to relax my whole body. My heart rate is going to go down. My digestive system is going to feel like it works maybe just a little bit better. That connection is why sex is important. And it's not just sex, it's intimacy. It's holding somebody's hand. It's, like I said, giving somebody a hug, or just connection. This is why sex or intimacy is so important. And a lot of times I like to emphasize with my couples and with my individuals, it's not the penetration, it's not the actual act of sex, it's just connection with one another. We need that connection to survive. We're humans. This is a part of us. Sue Johnson did a study actually on couples, and she saw that when she did an MRI scan on a couple, that when the wife was sitting under the MRI scan, her brain was firing. She was really nervous. She didn't know if she, had this brain cancer and all this stuff. But her husband came in and he held her hand, and her brain just calmed down. It stopped. It relaxed. And that's why this is so important. This is why this type of therapy is so important. I wrote some statistics down up here of some issues that have come up probably within the last few years that involve sex or couples or individuals. 80% of couples have sexual discrepancies, so this isn't just like cheating or infidelity or anything like that. This could just be lack of communication, not having sex, not having any intimate connection. 75% of couples therapists don't discuss sex and intimacy. So a lot of times couples will come in and say, hey, I'm struggling with communication. Okay, well, sex and intimacy also involves communication. So why aren't we talking about it? And a lot of times, a lot of issues aren't resolved with couples because we're not addressing it. Erectile dysfunction occurs in 90% of men before the age of 40. There's been a 20%, decrease in sexual activity and intimacy in married and non-married couples under the age of 30. To me, this is very alarming because we should want to connect, and especially for young new couples, what's going on here? So these are things that I think are important and need to be discussed, and what's going on, what's causing all of these issues. So how I approach sex therapy, these are the modalities that I use. So I use EFT, so emotionally focused therapy. I use the sexual and emotional cycle. So EFT, we commonly use that here at the Arizona Relationship Institute. So just to explain it briefly, which Linnell explained perfectly earlier, is that we have two roles in our relationship commonly. So I'll use myself as an example. So let's just say I'm a withdrawer in my relationship with my husband, and he is more of a pursuer. So every time that we get into an argument, we get into this thing called the negative cycle. So that is a part of emotionally focused therapy. So let's say I ask him to do the dishes. The dishes have been piled up in the sink, and my expectation in my mind is he's going to do them right away. If I ask him to do it, it's going to happen right now. And he chooses not to do it. So my reaction to that is that, okay, he doesn't care. So I start to withdraw. I start to stonewall him, and I start to say passive-aggressive comments. These passive-aggressive comments trigger him because, I don't know, maybe his mother used to say passive-aggressive comments to him. So then he starts to become argumentative with me and say to me, well, what's wrong with you? Why are you treating me this way? What's going on? But to me, that makes me withdraw even more. So, and then we go in this continuous cycle of not communicating when we have these underlying issues, without getting too much into it, that are affecting our communication. So this is an emotional cycle. So, and then let's just say later on, because I'm upset, because I'm anxious that my husband hasn't done the dishes, I want to engage in sex or some form of intimacy, but he doesn't want to. So we actually reverse roles. So I become a sexual pursuer and he becomes a sexual withdrawer. So to ease my anxiety of these dishes not being done, I'm like, okay, I want to have sex. This is going to make me feel better. But for him, he's so stressed out and angry with me, he withdraws and he disconnects from me and turns away from me and doesn't want to talk to me. So these are the modalities that I would use with my couples and help them identify what is my emotional cycle, so how do I communicate outside of sex, and then how do I communicate inside of sex and intimacy. The next component that I use is just sex education, so understanding how does our body work, how does it function, being able to look at our parts in the mirror and know what are my parts, what do they do, how do I achieve my own pleasure, and how can I share that with my partner or with myself. The other one is sensate and mindfulness. So sensate exercises are usually when, let's just say if I had a couple, I would tell them that, okay, if you touch your husband's elbow, how does that make him feel? How does he feel about you touching his elbow? Does it make him feel good? Does it turn him on? Or does it make him feel uncomfortable and say, why are you touching my elbow? This is really strange, right? So what is that reaction? What am I feeling in my body? Do I feel connected or is it pulling me away? And then we go throughout the whole entire body and it's built up in stages. Mindfulness is just connecting to my body and feeling secure and knowing when am I starting to feel just feeling connected to my body. And then lastly, EMDR. So eye movement desensitization reprocessing. I've done this with a lot of my individuals, especially with sexual trauma. It helps them release a lot of that tension that they might be holding in their body that's disconnecting them from feeling that they can obtain pleasure or feel safe and secure in those sexual interactions. All right. Well, that's all I have for you today. Any questions or anything? Go ahead.
You had mentioned that there's a 20% decrease in sexual activity and intimacy in married and non-married couples under 30. And you said that's kind of a trend. I was wondering, what have you come up with as far as why?
I think a lot of it has to do with our engagement in technology, quite honestly. A lot of times we're so disassociated and focused on not connecting with each other and just like looking at our phones and looking at social media and not like doing things or engaging with one another. And I've noticed that especially with younger people or younger couples, is that they have a really hard time just being comfortable just engaging with one another. So that's just my theory based on that. And then, I mean, there's other factors that could be because of that, but I think that's commonly what I've noticed.
So what are some of the things that you talk to your clients about and how to connect in that moment?
So having somebody that wants to connect and somebody who doesn't want to connect.
Yeah.
So what I would have them do is just seeing like, well, okay, you know, maybe you have somebody who is more of a sexual pursuer and somebody who is more of a sexual withdrawer, is you're going to have to see, well, what do I need? How can we meet in the middle? Like, what can we do? Because this is important to my partner, is they want to engage in some sort of way. So can we find like a middle ground? Maybe it doesn't have to be the actual act of sex, but can we just hold each other? You know, maybe it's for 5 minutes and see where it goes. You know, things like that, just finding that middle ground, or what do I need to feel safe or secure? What's coming up for me? Why don't I want to engage? Is it something my partner's doing or saying that is causing me to withdraw or disconnect even more? Okay.
Good job.